some of the most common problems that we see in young children are early childhood caries or cavities on really young children. And we'll see that from ages 1 anywhere up through adolescence. And some things that, that we can do on really young children to avoid those cavities. A lot of times it can be associated with drinking a lot of milk or juice. When a child drinks a lot of milk or juice throughout the day, so there's a high frequency of it where they're walking around with a bottle or a sippy cup and they're drinking that, it creates an environment in the mouth where cavities can happen very easily. And if a child is already high risk for cavities and they're doing that, then things really can explode from there. So a lot of times we're having to sedate very young children, 1, 2, 3 years of age to fix several cavities. So I think something that's simple that parents can do to avoid that is limit the amount of juice and milk that they're giving them or the frequency that they give it. What we'll typically say is at meal times, they can have milk or juice or whatever the family's drinking, at breakfast, lunch, and dinner. But in between meals, just try to stick to water, and especially at night, going to sleep. A lot of kids love to go to sleep with milk or juice in the bottle, or heaven forbid soda, and that can just wreak havoc on those teeth. So that's something simple that can be done to avoid the pitfall of early childhood caries.
Another thing that can really help is when those 6-year-old molars come in. These are the first permanent molars that grow in at the very back of the mouth. They don't push any baby teeth out, so lots of times parents aren't even aware that those are coming in, and it's really good to place dental sealants on these 6-year-old molars. They have deep fissures. We call them grooves. They're really called fissures, and what we do is we apply a dental sealant to the groove of the tooth. It doesn't require any local anesthetic. Most kids can do it very comfortably and very easily. So that helps protect the tooth, especially during those growing up years when kids are small and probably not paying attention very well to their oral hygiene. Another question we get a lot is, when can parents stop assisting with brushing teeth? And it's really difficult to answer that question because every child is a little bit different. One thing to think of is, when can a child tie his or her own shoe? When do they pay attention to detail? When do they make their bed? When do they clean their room? And every child's a little bit different, but it's good to assist kids early on, sometimes up until age 6 or 7, depending on how much they pay attention to their own oral hygiene. Another question we get a lot is, what is our take on fluoride? Fluoride seems to be a hot topic, and it's been proven that fluoride helps strengthen the enamel of the teeth, which is that outer layer on our teeth. And when we take fluoride at appropriate levels, it strengthens that enamel, makes it more resistant to the acidic environment that happens inside our mouths from the naturally occurring bacteria that are metabolizing all of the plaque on our teeth. So fluoride at appropriate levels is very helpful. And in many communities that we live in here in our community, the water is fluoridated. So we don't traditionally in our practice provide a prescriptive fluoride supplement, but we do encourage parents to brush their kids with a fluoride toothpaste, even from age 6 months or 1 year when those first teeth come in, but you don't use any more than the size of a grain of rice until the child is able to predictably spit out the toothpaste. So it's not true that kids can't swallow any fluoride. It's just true that they shouldn't swallow too much fluoride.
Yeah, that's a common question. Something else that we see a lot in our practice is shark teeth. And what that is when a child has maybe some crowding in their mouth or tight teeth, permanent teeth will start coming in and they won't push out the baby tooth. And so you've got rows of teeth in the mouth. And honestly, we see this every day in children. It's very common. And there's a lot of different things that we'll recommend. If the tooth does look like it's going to loosen on its own and can come out, a lot of times we'll give it a little bit more time and tell the parent, have the child work on it, try to get it out on their own. if we take a radiograph or an X-ray and see that the baby tooth root hasn't dissolved the way that it should, then we know that tooth isn't going to come out, and we'll a lot of times recommend that we take it out so the permanent tooth can come into a favorable position. And around that age, 6, 7 years old, if we notice that a child has a lot of crowding, we'll even recommend sometimes that they see an orthodontist. And that doesn't mean that the orthodontist is going to put braces on that child at that age. But there are some great things that an orthodontist can do with certain appliances that are minimally invasive that can minimize the amount of time the child is in braces later on. And excuse me, encourage those teeth to come in to the best position possible. So those are kind of our take on shark teeth and crowding as well.
Another question we get a lot, and Dr. Gustafson, I think will agree with this, is questions about binkies, pacifiers. Kids will suck their fingers. It's very difficult to prevent that. We don't encourage parents to try to prevent that. Infants are infants. They need to sleep. Parents need to sleep. And we are not at all opposed to pacifiers. It's just nice to take the pacifier away, if at all possible, at the right age. And that's between ages 2 and 3. Often the binky will move the front teeth. It'll move them forward and upward just a little bit. And that's fine. And it's interesting how if that binky is removed between the ages of 2 and 3, not going beyond 3, those teeth will often, most times, move back into position. So we're not against the binky at all. In fact, I've often pushed it on my own kids when I felt like they wouldn't take it, because you can't take a thumb away, but you can take the binky away. As long as you take it away at the right time, it doesn't seem to cause too many issues.
For sure.